We welcome you to our module COPD, Chronic Simple Bronchitis, HCC 111 from MRA Tips. This module has been developed specifically for MRA reviewers as a refresher on diagnosis criteria, documentation, and coding of chronic simple bronchitis. At the end of this module, the learner will be able to define chronic simple bronchitis and smoker's cough. Discuss the criteria for the documentation of the diseases. Note the ICD codes that fall under chronic simple bronchitis and smoker's cough. Review the example of the assessment and plan for the diseases. Identify the exceptions to keep in mind while coding for these diseases. In the ICD-10 codification, chronic simple bronchitis is synonymous with smoker's cough. While chronic bronchitis is another form of COPD which results from the inflammation of the lining of bronchial tubes, smoker's cough is a persistent cough that develops in long-term smokers. During bronchitis and smoker's cough, a persistent cough results in a thick mucus being developed in the bronchial tubes, thus preventing the air to pass to and from the lungs. Chronic bronchitis develops over time, when the blockage of airflow gets worse over time, characterized by recurrent episodes of bronchitis that last for several months or years. Due to the mucus, breathing becomes increasingly difficult, accompanied by wheezing which gets worse with physical activity. Some of the common causes of chronic simple bronchitis include active or passive cigarette smoking, extended exposure to air pollution, industrial or chemical fumes, and toxic gases, while the primary culprit for smoker's cough is excessive smoking. The main criteria for the documentation of chronic simple bronchitis and smoker's cough include a note indicating whether the patient is a current or a former smoker, a documentation of persistent cough that is present for a period of time of more than 3 weeks, and a positive respiratory physical exam. There is no need for a PFT, chest X-ray, or a CT scan to support the diagnosis. Let us look at the ICD codes involved in chronic simple bronchitis. For simple chronic bronchitis or smoker's cough, the code is J41.0, HCC 111. For uncomplicated nicotine dependence and cigarette, the code is F17.210. For tobacco use, the code is C72.0. The assessment and plan should address the diagnosis and include 2 support indicators. Let's see an example of a progress note. Patient name: Christopher Baker. Date of cervix: November 9, 2017. Date of birth: July 12, 1944. Assessment and plan: chronic simple bronchitis. Cough improved. Stop smoking. Continue with Spiriva, 2 puffs, 1 cap inhaled QD. Avoid things that irritates the lungs such as perfumes, smoking, and air pollution. Follow up in 1 month. Exception: episodes of acute conditions such as pneumonia or a viral process as supportive symptoms are not to be coded as they are not included in the aforementioned criteria of nicotine dependence and tobacco use. We have reached the end of our short refresher course on COPD, chronic simple bronchitis. We gave you an introduction to the disease, identified the criteria and the ICD codes for the documentation of bronchitis, reviewed the assessment and plan, and finally discussed the exception which is to be kept in mind while coding for chronic simple bronchitis. Thank you for joining us.